Hello, and this is do-it-yourself video production and do-it-yourself pain relief by Jenny Sprung. Hello everybody, welcome. I am an integrative neurosomatic therapist. I've been practicing for years. I'm also a certified zero balancer. I teach at the Center for Neurosomatic Studies. And I have found many of the things that I am going to present to you in the videos have helped my patients, my clients, to heal in between sessions. So find a good healing team, a duo or a triage, a group of people that are qualified, well-trained, educated, and in between, do this. If your feet hurt, do your feet hurt? I posted something on the computer and got a ton of responses. Everybody says, oh, I've got a neuroma, I have this, my foot hurts. I think one person said my foot is foreign to me. So if your feet are talking to you, it's really important for you to answer. They are your foundation joint. They are your connection to the earth. They have everything to do with your posture, your gait. If your feet hurt, your whole body's going to hurt. The first thing I'd like you to do is consider plunging your feet into cold water. And I know that doesn't sound very attractive, but it really works. There is an article on my website about cold therapy for the feet, and you can learn a little bit more about how to acclimate yourself and do that. I would recommend that. However, a more appealing and more appetizing would be to soak your feet in warm Epsom salts. So grab a pan, grab a container, pour a bunch of Epsom salts in warm water and stick your feet in them. And while your feet are soaking and enjoying the warm water, move them around. Do a little eversion, inversion, pronation, supination. Roll the ankles. You can spread the toes, squeeze the toes. You can also take a plastic ball in the water with you and roll. And we're going to do more with the balls and rolling in just a minute. But inside the tub of water, if you have a racquetball, lacrosse ball, tennis ball, even a dryer ball. These are a little tricky, but they're really soft. They're much softer than a lacrosse ball, and a racquetball is super soft. So start with the soft one and just place it in the water while you're soaking your feet and roll it around, and you'll find a spot that's tender. When you're seated, you're not going to have that weight, that gravity, that standing will give you as far as really digging into trigger points. And you can't be too, don't push too hard, but you can't be too gentle with the feet. The feet can actually take quite a bit. And the plantar fasciitis, itis is just inflammation. You can affect change in your feet. You can make them softer, you can make them spread out. You can make them much happier if you tend to them. So when you're sitting at the computer, soak your feet, or roll your feet when you are watching your favorite show. You know, find times and have your basket of balls, wherever that is, and go for it. So soak your feet, plunge your feet in cold water. So how long should you soak your feet? Anywhere from 10 to 20 minutes. Less is fine, and more, I don't think you need more. The water will get cold. How long should you plunge your feet? Not very long, especially for starters. And you're in charge of your own wellness. You are empowered to make yourself feel better. So you make the decision. If it doesn't feel right, get out of there. If it hurts, don't do it. What we're trying to do is release trigger points, soften fascia, create better energy flow from the feet all the way up and back down again. So having said that, let's just talk, let's say you have soaked your feet and they are ready for you to work on them a little bit. So sit on the floor, make sure you're seated, don't slouch, shoulders back, and grab the foot and just roll it. I'd like you to roll it one way and roll it another. And I have really flexible feet. I'm lucky that way. Those that have flexible feet, their head may hurt them. And there's videos on the cranium, the eyes, there's videos on the viscera, there's videos on legs and arms. So please come and visit my site, treatyourselfnaturally.com, for more resources on how you can treat yourself naturally at home in between qualified professional treatment, okay? So I'd like you to move the bones. There's an article that's associated with this little video on the feet, and there's some anatomy, just enough for you to have a landmark. But this is not an anatomy class, this is simply a treat yourself naturally, so give it a good stretch. You're going to want to really pull the toes. Now I'm holding the leg up so you can see, but do this in any way that's comfortable for you. Point the toes, okay? Flex the toes and point the toes. Get those pedicure toe separators and put them in and sit with those in for a few minutes. Some people use those all day long, and you can also go online, and they're called yoga toes. They're pretty neat. My article shows places to get those, and of course you probably have them in a drawer somewhere. Separate the toes and then push through the dorsal side of the foot, and you can push all the way from the ankle down. There's going to be some spots that are pretty tender in here, and just move the bones a little bit. As you're moving, you can press inside the plantar side of the foot, and that's for a lot of people, you know, feel the pain. Some pain is in the ball of the foot, but they can feel it all the way through the foot. I'm going to work not just the foot, we're going to gently work the ankle and the heel, as well as the low leg. So I would like you to look on my site for the tools. These are inexpensive and very useful, especially for feet, and you're really going to want to go in and just wiggle them around counterclockwise or clockwise, or just go in and find a spot and breathe. Trigger points, healthy trigger points release in about 8 to 12 seconds. Sometimes you need to come out and give it a break. Don't overdo it. Don't overdo it. And then go back in again. Go in between each one of the toes on the bottom of the foot. For those of you who can't reach your feet and are not able to do this, I'll show you other options in a minute. Okay? So go into the arch of the foot, and it's usually very tender whenever I work a client's arches, and you know, you have to go in and come out. But you also want to learn to hold it and breathe. And how much pressure? You know, just enough to, remember when you learned how to write, when you wrote really hard, maybe like that. So it's not, you're not pounding away. I also ask you to listen to your body. Focus on where you are. Try not to do anything else. Put some good music on and just treat your feet. It's just you and your feet. You know, just you and your feet. And then come up into the heel, and all around the border of the heel are amazing attachments, and then when you come up into the ankle. So using the tools, any tool you'd like, that's pretty intense. And this is also, you'll run into a lot of meridian points. We will not get into the meridians here, maybe in a future article. But for now, I just want you to know that all of these points can be released. And they'll feel good. It'll feel really good. You can even soak your feet after you work them. You can make a therapy hour for your feet, or if an hour is just unrealistic, make a therapy 20 minutes. Any abbreviated part of this video will help you. So, all on the bottom of the foot, you can find a trigger point. Every one of the metatarsals and the tarsals. You can even work the toes. And it really just wringing the toes is superb, moving the toes around. Now, a lot of folks have bunions or hammer toes, and you're going to need to work the whole low leg as well as the attachments down in the foot. But, you know, be gentle with those bunions, those sore toes if your toes are really sore. But still, they need to be moved. That movement in those joints has to happen. We need blood flow, we need oxygen. So do whatever you can. Another way to bend, and I'll just go out of the foot. I'll go out of the video for a minute so you can see. Standing up very straight, pushing down on the top of the foot and doing that. And then of course, a runner stretch here and then just moving up. You can also just lift. And you're going to want to hold on to a wall so you don't fall over when you do these standing stretches or movement, and spread your toes out, yoga toes, really spread them. Okay, so while I'm standing, I'm going to show you a couple of balls underneath the feet standing. Again, make sure you're steady, make sure that you have balance, and that you are not going to hurt yourself while you're trying to create a therapeutic change. This is an amazing little ball. This is a ball that you can get from TheraBand, and it is perfect. It has not points, but little squares that come out, and it is superb under the foot. It is just great. And here, you're just going to work the whole bottom of the foot. Waiting, holding on, balancing, using good posture, and breathing. Your breath should be 2 to 4 counts in, and then longer out, 4 to 8 counts out. That creates relaxation, creates blood flow. Now, in the arch of the foot, it's going to be pretty sore, so don't overdo it. You see, I've got my whole foot down, and I'm releasing and relaxing. And some of you can say, well, this is just what I need. Oh yeah, this is intense. Find that spot right in the middle of the fascia. Come off of it, go back on the other leg, and then come in and count out your 8 to 12 seconds. 2 or 3 big. Inhale. Exhale. And come out. Now go into the heel. And here you're going to put the toe, the ball of the foot down, and just roll around on the heel, and you will find the spot where the fascia attaches. And that's intense. It's important to get where the fascia connect, not just the belly of it, but the entire foot. Okay? So now here's some other options. A dryer ball. If you can't afford anything, just get a dryer ball. These little pointing protrusions on the ball are fine because it's a soft ball. This is so good for your feet. This should be done. If you have pain in your feet or toes, you should be doing this, because this is just going to create so much blood flow, so much healing. You can also use a tennis ball and a harder ball, a lacrosse ball. And when you start to use the tennis ball and the lacrosse ball, you'll start to feel that referral all the way up to the knee. Through the calf, through the front of the leg, the shins, the tibialis anterior, tibialis posterior, you'll feel it all the way through. So you can do this, until you start to feel some warmth and blood flow, and take a break and come back to it another day. Here are some of these rollers. These are triggerpoint.com rollers. These are excellent for low leg, for foot, for hands, and for forearms. But for now, I want you to just see how they look. And they really spread all of the muscles inside the foot. They spread it out. So if you can, these are expensive, triggerpoint.com. But, if you can't afford them, you got a cookie dough roller, maybe you can modify it. Safe and appropriate usage for all of these things. And these are not that great for the heel. They're better for the arch of the foot and better for the ball of the foot. And see, I injured my left knee years ago in soccer, so even my left foot is much more tender than my right. So here's a trigger point. I can roll back and forth, and I can hold onto this. If you have a neuroma, please go carefully, but consider that the neuroma is feeling squished. Something is happening in the foot. You may have had an injury, so soaking it is very important, but also giving it some love, giving it some attention. Again, if it's talking to you, talk back. These are a few more options. These are really great. I prefer the balls, but these are TheraBand, and they're also on my website. And if your feet are real sensitive, super sensitive, then the TheraBands are going to be your choice, because they are, you can compress them, and they also are not that hard. The large foam roller doesn't really work for the feet, but you can try it and see. Lacrosse ball is going to be outrageous, but very good. So now find a couple of tools. So you can find a massage star on my site. You can find any of these neuromuscular solutions, T-bars. You can make your own. My dad makes them for me. And you can find a stone. And since the stone might be the easiest and less expensive, just a little effort, you can start to work the dorsal part of the foot. And here you're going to go real light. Not too much pressure, because it's going to be tender all through it. And you may want to do some stretching of the fascia first, and that will suffice. So just stretching the fascia all the way up. And you can stretch the fascia on the leg. You can wring out the leg. Notice if you find a restriction rolling under and out, or if it's easier one way than the other. See, my leg is much easier this way, so I would go against and create some warmth in that fascia, create some space, some oxygen flow, blood flow, and find the Achilles, the gastrococcolius. Here is where these trigger point rollers come in amazingly. So you can bridge up a little bit, and here you can get all of that low leg. And this is pretty intense. Now for those of you who are, ready to go for it, and you feel like you've done this enough, make sure you put a little more weight on your bridge up. Don't slouch, the abs are tight. I teach a foam roller class, and I can tell you, when we go into this part, people just start to moan and groan. This is something. So you can turn to the side. This is all of the fibular compartment, the fibula, the tibia, this fibular compartment. It goes all the way down into the foot and all the way down into the toes. Once again, you're going to need to be able to bridge up, and it's going to be tender. You'll start to sweat. You really will. All the way up to the knee. All the way up to the knee. Once you get up into the knee, you're going to want to roll. And when I say up to the knee, I mean just below it. So all into these muscles. To get to the front of the muscle, what you're going to want to do, and this is my inter-drag. It's always, I manage quite well because I foam roll it. But I go into this part of, or just underneath the knee. So another, two things. You can either flex the leg you're working, make it tight, taut, and flexed, or you can relax it and see which one works for you. Going one way, rolling across the fiber, and rolling with the fiber. Across the fiber on the calf muscles is outrageous. Excellent. You can move the ankle while you're doing it. And all of that is fantastic. Fantastic. And so there is many ways to use both of these. If you have large calves, use a larger roller. If you have tiny little calves, use a tiny one. If you feel like this is too much pressure, but this isn't enough, just give it a little push and rock with it and go all the way down into the ankle. Now this is where I want everyone to work, is right here, right where the Achilles attaches. Come into that and watch out because your rollers will roll away and push into it. For those of you who wear high heels, and you know who I'm talking about, you got to do this. Flex and point, roll the ankle, get some movement there. And you can go to the side. Now some of these movements are going to be difficult for you. Contact me on my contact page and perhaps we can find some other information for you to help you. But this will all help the foot. I feel this all through my toes, right here. Yeah. Okay, here's a more advanced position. And this one's hard for me, but I can do one leg. So I am going to use the large roller. I'm going to place both hands safely in front of me for support, just like table legs. My left leg is going to be standing over to the side here as another third leg for support. And I'm going to roll out the front of my right leg. I'll give you 2 or 3 different angles, but I want you to see this. Some folks are flexible enough where they can do both. I can sort of do the yoga cat-cow and roll on them, but this is, I find, difficult for me. I'm getting older. Some things are harder for me to do, but this is so good. Oh, it is really good. Superb. And there's a spot over on the left leg that's shocking. And if it's shocking, if you have to jump, get out of it. Find a place above it or below it and go in and hold it. So don't forget this as well. And if you're really super flexible, you can come up and work the feet. But that we'll save for another video. So now, let's talk about how to affect the small attachments down in the ankle. So come back to your tools. Come back to your stone or your beveled edge tool. We'll use a beveled edge tool. And come all around the lateral malleolus. And this is going to be tender. Super tender. If you have swelling or edema, you need to go see your doctor. And walking is good. Movement, connecting with the earth, all good for the feet. Super. You can work all around. There's muscles all through here. Notice how I'm touching and wiggling. And then I'll find a spot and then do that 8 to 12 second practice. And 2 or 3 nice long breaths. The last piece that I'd like to show you, and this resource is also on my website, and I have had this work for almost every single person that has had a foot injury. Folks have misstepped, their foot has gone in a hole, they've misplaced their foot on a bicycle. So many things is this. This is a calf stretcher. However, the calf muscles go down into the foot. Everything is connected, right? So I'm going to stand up again to show you this. Make sure you're balanced and safe, and make sure that you are not going to hurt yourself. You're going to use the instructions that come with this. And most of my weight is on the other leg. I am not putting all the weight on this just yet, and that's how you're going to begin. Just going to move it. And then when you get a little bit better, you can hold on to something and start to put more weight on it. Push forward, push backwards. As we get older, things start to get a little bit less smooth. They get a little more of a rocky road, so to speak, a little less little more brake pads going on rather than smooth road. So I hope all of this helps you to create space, balance, and love in your feet. Please come and see me. My name's Jenny Sprung, and now Do It Yourself Video Productions turning it off. Thank you.